Good evening, everyone. We are about to start in a minute. We just had some initial technical difficulties, which seems to have been resolved. I've got some member of the audience with their hand up, but I think you are administratively on mute, so I'm unable to unmute you. So we'll start in a minute. Okay, thank you. I think we've got all our speakers here. Okay, thank you. So, welcome and good evening to all of you. I'm Dr. Lalita Iyer, and I'm the Chief Medical Officer for NHS Frimley. I also have the privilege of being the Women's Health Champion for the Frimley Integrated System. It is my great pleasure today to host the second in the series of our webinars on looking after yourself. Today's topic of focus is on women's health. Thank you to all of you for joining us in this important conversation that's dedicated in celebrating and advancing women's health. Today, we're bringing together a diverse and dynamic panel who you can see on the screen to explore a wide range of topics impacting women's health, discuss and share insights, and give you different perspectives. Our goal this evening is to empower each other with knowledge, support, and give you links to trusted resources. Let me begin by introducing our panel for this evening. And panel members, please say hello. Anne Deans, Chief of Service for Obs and Gynae at Frimley Health Foundation Trust. I've got Azmi Birdi, who is a GP with special interests in gynecology and also our clinical lead for women's health at NHS Frimley. Caroline Port, our lead pharmacist for women's health in NHS Frimley. Catherine Ross, advanced physiotherapy practitioner, pelvic health, and Sarah Rayfield, who's working in SLAB. The plan for this evening is initially to have a short presentation from Anne, setting the scene, followed by a conversation with my panel on various topics. Today's events is about providing you with a general overview of women's health topics, encouraging and empowering you not only to look after yourself, but also to inform you on when to seek help. Based on the feedback we received today, we will bring you more detailed and in-depth discussion on specific topics that you may be interested in hearing about. And so, Anne, could I invite you to start your presentation, please?
Thank you. I'm just going to share my screen.
Thank you, Anne. We can see your slide.
Lovely. Well, I'm delighted that so many people are here wanting to know about women's health and also to discuss with us the issues that they may have. But first of all, it's useful just to remind ourselves about female hormones, because when puberty starts up until the menopause and even beyond, female hormones play an important part in our life. And let's just hope that everybody respects our hormones. First of all, just remind you that we're governed by a monthly cycle. Every 28 days, if you're not on the pill or you haven't gone through the menopause, you will find you'll get a monthly cycle. So day 1 is usually counted as the first day of your menstrual period. And then in the first 14 days of the month, you can see that estrogen is the dominant hormone. And that swings through our bloodstream and it thickens the lining of our womb. And then in the middle of the month, one of our ovaries releases an egg, and that egg then determines what happens to your hormones in the last 2 weeks of your menstrual cycle. And progesterone becomes the dominant hormone. That's the hormone that makes us feel moody, perhaps makes us feel a bit bloated, gives us the feeling that we might be feeling a little bit low. And then if day 28 comes, that's when we'll have another menstrual period if we haven't fallen pregnant. And in fact, those hormones are governed by our brain. Our brain produces hormones called LH and FSH. They send out messages to make our ovaries work to produce estrogen, progesterone that then governs our menstrual cycle. And if you look at this diagram, you can see that if you start to get estrogen in your circulation from when you're about 8, menstrual periods don't start then, but when you start to become a 7, 8, 9, 10, you will have estrogen in your bloodstream as a young girl, and then gradually that estrogen takes you through puberty. And in your 20s, 30s, and 40s, estrogen is the dominant hormone, and that makes you into a woman who's having menstrual periods who can fall pregnant. But then we reach the menopause, and unfortunately, that's a time when our ovaries start not to work. And ovaries, we don't understand why, but they're on a time clock, and it doesn't matter, what ethnic background you are or what sort of family genetics you have. Most of us will start to go through the menopause between the ages of 45 and 55, and gradually our estrogen levels drop until they're in our boots literally by the time we're in our 70s and 80s. And that's a time, of course, when women get menopausal symptoms because of the lack of estrogen in their bloodstream. And that's the sort of thing that brings on hot flushes and night sweats. So let's just talk a little bit more about the menstrual cycle. The stages of the menstrual cycle are illustrated here. And remember that your uterus, ovaries, and fallopian tubes and cervix are buried deep within your pelvis, as this diagram shows. Your cervix is located at the top of the vagina, and here's the vagina here, just at the entrance where your vulval tissues are. And each month what happens is that the hormones in your circulation make the lining of your womb thicken up, and that starts thickening up here in what we call the follicular phase. That's the first 2 weeks of the menstrual cycle, here in yellow, and the womb lining, the uterine lining, thickens up. You then ovulate, and during ovulation an egg is produced from the ovary here, travels along the fallopian tube, and if it meets up with a sperm in the fallopian tube, that's when an embryo will enter the uterine cavity and will implant. But if that doesn't happen that month, you don't fall pregnant, then that thickened womb lining, all ready to receive an egg, is then shed as a menstrual period. And we know that if you think of that womb lining, that uterine lining, shedding because you're not pregnant that month, so it's not needed, it will shed as blood. So menstrual periods are perfectly normal. They're clean. They shouldn't be regarded as anything untoward or unclean. It's just simply your uterine lining being shed because you haven't fallen that pregnant that month, and you're going to start a new menstrual cycle here. And if you look, here's the cervix, here's the vagina, and of course, as you get older and you've had children, this is where prolapse can occur, and the tissues of the vagina get weaker after childbirth as you get older and when estrogen starts to decline. And when people talk about prolapse, this is the area where they may get a bulge down below and perhaps have discomfort with opening your bowels or passing urine. So we go through various stages being a woman. We go through puberty, and for most girls, that starts with production of estrogen from their ovaries when they're about 8 or 9. Of course, they're not having menstrual periods usually by then, but they'll start getting breast development. They'll notice that they get hair under their arms and in their pubic area. They may start to get sweaty, need to wear deodorant, and then eventually menstrual periods will start. And for many girls, that's somewhere between the ages of 9 plus to about 15. The next stage in our life, of course, is the fact that we can fall pregnant. And that's a time when our bodies change. During pregnancy, estrogen, progesterone hormones are very high indeed. Some women feel very well during pregnancy because they have high levels of hormone, particularly estrogen, that makes them feel well. Other women find that those very high hormone levels make them feel very unwell during pregnancy, and particularly feeling very sick in the first few stages of pregnancy. Then, of course, we go through the next stage of our life, which is the menopause. And that's when estrogen and progesterone hormones disappear from our bloodstream and we get all the symptoms of the menopause that you've probably heard about on the news, and you may even have suffered from yourself if you're of that age. Brain fog, difficulty concentrating, hot flushes and night sweats, and the body goes through changes. They're perfectly normal, natural changes. They can occur anytime from 40 plus, and they can carry on through the whole of life. But they are natural changes. But fortunately now we have got the option of going on to hormone replacement, HRT, if we need to, if the symptoms are causing problems, that they're interfering with life. And of course, during the time of the menopause, the lack of estrogen hormone makes our bones get thin. And that's why taking estrogen for some women is the right thing to do to keep their bones strong. But taking regular exercise, eating healthily, those things are just as important during the menopause. Weight-bearing exercise, taking long walks, all those things can keep your bones and muscles strong. And then just to point out that us women, we do need to think about screening, both cervical screening, and that's having your smear taken. In fact, we're now talking about cervical screening rather than having a smear test. But I think most people know smear tests start when they're 25. You'll be recalled every 3 years up until the age of 50, and then it goes to every 5 years. And you can stop having a smear test after the age of 65 if your smears have been normal. And this involves having a speculum examination and having a sample of your cells taken from the cervix. And the other thing is to remember about breast screening, and that involves women aged between 50 and 70 who are screened every 3 years. And you can see a lot of people end up going to the mobile breast screening. Now, people don't like having screening. They feel embarrassed having internal exams. They feel embarrassed getting their breasts out and being screened. But believe me, going for your screening is one of the most important things you can do for your health, because both breast screening and cervical screening, catching abnormalities early means they can be easily sorted out so they don't bother you again. And it's a lifesaver to attend for screening. So I'm going to finish the talk now, and thank you very much for listening. And we will now Dr. I will be explaining how we will answer your questions and hear from you.
Thank you, Anne. Very simple but extremely informative presentation. Thank you for that. So before I bring our panel into the discussion, I wanted to highlight to our audience that we will be sharing some useful resources in the chat. These resources are designed to provide you with information and support you need so that you can make informed decisions and take proactive steps. You are also meant to be seeing a Q&A tab, which is at the top next to the chat. And although the chat itself has been disabled by our management administrative team behind the scenes, if you click on the Q&A tab, you should be able to ask us questions, which we can then see. If you are unable to see the Q&A tab, please do let us know. We are looking into this, but I will proceed with asking my panel some questions so that we can actually carry on with the panel discussion. So I wanted to first of all go to Azmi. And Azmi, while we know that having a normal smear is quite reassuring, we would like to emphasize that a smear only predominantly picks up abnormalities in the cervix, and therefore one does need to seek help if you have other symptoms. So it might be quite good for us to highlight what these symptoms might be and when to seek help.
Yes, so thank you, Lalita. So smears are just for the edification of everyone in the audience. Smears are a way of preventing cancer by picking up abnormalities early. We're not doing cervical screenings to detect cancer. Now, cervical screening works very well, the smears but it's not perfect. They're basically, at the moment, the cervical smear, as Anne explained, the speculum is inserted and a sample is taken from the cervix. Now, that looks for a virus called high-risk HPV. And most of us will acquire human papillomavirus or the HPV virus at some point in our lives. There are about 100 types, but there are certain subtypes that are very strongly linked with cancer. And the thing is, if it's detected, then we go on to look at the cells in the cervix. And the good thing about the cervix is that the cells are on the surface, they're easy to look at, and they go through a long period, several stages and many months and even years of abnormalities before they develop into anything dangerous or cancerous. There are other things as well that the cervical screening does not pick up. So, for example, things which are inside the lining of the womb, which is called the endometrium, certain infections which are not related to human papillomavirus that may lie dormant for a long time. So any abnormal bleeding, any intermenstrual bleeding, bleeding in between your periods, which is new or unusual, any bleeding after sexual intercourse, any pain during sex, any abnormal vaginal discharge needs to be flagged up, and you can contact your specialist nurse in the GP surgery if they're the one that does women's health, or speak to your GP. Remember that no test is 100% effective, and even when the cells are checked under the microscope, sometimes there are insufficient cells, or there's bleeding, or sometimes the distribution is such that you're looking at only the normal cells and abnormalities can be missed. The HPV virus can also stay dormant, so you can test negative at one time and a positive at another. So it's important that symptoms must be checked.
Thank you, Azmi. Needed to get off mute. So, and I suppose we want to reiterate the same thing in terms of mammograms as well. So if you've had a mammogram 3 months ago and is completely normal, if you find a lump, please don't hesitate to seek help. On the topic of smears and screening, I'd like to ask Sarah, please, to tell us a little bit about the HPV vaccine. Why have it? Where is it given? The number of doses and so on. And also, what can one do if they have missed the vaccine?
Yeah, absolutely. So the HPV vaccine essentially is a vaccine that protects us against contracting HPV. So as mentioned, this is a common virus, the human papillomavirus, that's spread through skin contact and usually through sexual intercourse as well. So by having the vaccine, it helps to reduce your chance of getting HPV. And as we just were talking about, this type of virus is associated with cervical cancer and some other conditions. We recommend the vaccine for children aged 12 to 13 years old, but also some other people who are at a higher risk of HPV. So that includes some transgender people, sex workers, and people with HIV as well. But for the 12 and 13-year-olds, this vaccine is normally given through the school-based immunisation team. So you'll receive a notification through your school. It's one dose and given into the arm as well. And since we've had the vaccine in place, it's been around for a few years now, then there's been a really big drop in the number of young people getting conditions linked to HPV, so particularly cervical cancer and genital warts. And so we know that research suggests that over time, the vaccine will save thousands of lives in the UK. So it's a really important one to get. If you happen to have missed it, either yourself through school or your child, it is still available free on the NHS. So that's for all girls and young women under the age of 25, and also boys that were born after the 1st of September 2006. So if you're eligible for that but have missed it, then it's worth either speaking to your GP or school nurse or school vaccination team if still at school in order to make sure that you can get that vaccine.
Thank you, Sarah. Could I just ask the audience to put up their hands, virtual hands, if you cannot see a question and answer tab at the top where you're logged into Teams next to the chat? Thank you. So our administrator can get an idea while I continue. So, Azmi, we know that when a smear is abnormal, and the report sometimes mentions that a person is HPV positive or positive for the HPV virus. And it then brings up a lot of questions for the individual, wondering about how did I catch it? Is it contagious? And so on. So might be quite good to touch on what does this whole HPV positivity mean on a smear result?
So, as we've already explained, that HPV, the human papillomavirus, there are about 100 different types of human papillomavirus. 14 of these are defined by the World Health Organization as being high risk, and they may be linked to cervical cancer. Now, because we know that it is transmitted through, usually acquired during sexual intercourse, the connotation is that this is an STI. And people often, when they hear that they're high risk HPV positive, they feel ashamed, they feel dirty, they worry about having caught it from their partner, or that the partner may feel that the woman has been promiscuous or cheated on him, and they ask, should we use a condom? Should we, it affects relationships. Now, the first thing is that you can be in a monogamous relationship all through your life and, yet acquire human papillomavirus. There are people who have not even had sexual intercourse and have still acquired human papillomavirus. In certain parts of the world, it is endemic. So the first thing is, there's nothing to be ashamed of. The person may feel that I was low risk, I was negative at one point and I'm positive now. So does that mean that my partner has infected me? It can lie dormant for a long time. The acquisition of it is unclear, really, but it is something to do with the time of sexual debut and what happens at the time of sexual debut. But most of us most women who whether they've had one relationship or more, will have acquired HPV at some point. So will men, but men don't, there's no screening test for men. So I think the first thing is the woman should feel reassured that no one is considering her to be promiscuous, and it is a normal thing that many women have. Second thing is, there's nothing to feel really worried about, because the body in a normal immunocompetent woman who is healthy should be able to clear the virus, and only a very small percentage of high-risk human papillomavirus continues and goes on to cause problems. So the woman should be told that the next step will be that she will have her cells examined under a microscope, and she will be kept under surveillance for a period of time to make sure that she clears it.
Thank you. Thank you, Esme. So, Anne, we know that some women, in spite of a lot of reassurance, are quite apprehensive about the smear test. And in the media, there's been some publicity about self-testing for smears. Could you elaborate a little on that?
Well, yes, it's a shame, but a lot of women don't go for their smear test. And we're not sure why that is. When we ask them why, it's often because people are worried, is it going to be painful? And also they feel embarrassed. It's an internal examination, and particularly younger girls may perhaps worry that they're going to feel pain and they're not going to manage to get through the smear test. In fact, most practice nurses and GPs who carry out smear tests, it's undertaken in very quickly, painlessly, and everyone is used to putting a woman at her ease when she has a smear test. But we only have about 6 out of 10 women who are eligible to have a smear take it up. And therefore, there's been a big study looking at self-testing, and that involves putting a swab, a cotton wool bud type device, up through the vagina, and you put it into the vagina, you rotate it round, and then you put it into a container, and that can all be done at home, and that test is then sent off to the laboratory. And if it's negative for the HPV, then you don't need to go to for your smear test. And we're now trialing that. There's a huge project going on, seeing if that is as effective as having a smear test. And I can assure you the results are looking very, very promising. There's been a big project in London where all women who have refused or didn't want to come for a smear test have been offered this. Large take up, and it looks to be as effective as having a smear test. So I think watch this space. In the next 2 or 3 years, I think the program will be rolled out. But at the moment, please go and have your smear test. Be assured whoever's taking your smear test for you at your GP surgery understands that it's not the most pleasant thing, or at least you're scared or worried. They will put you at your ease and ensure that it's done as quickly as possible, and results come back within a few days. So you will get a result really quickly. So please go.
Thank you, Anne. And I have been asked to inform you by my administrative team that the chat function is now open. So if you want to, because some of you can't access Q&A while the majority can, so please do feel free to use the chat function like we normally do in any Teams meeting. And I wanted to come to you on the age at which periods start, and I know you touched on it as an average age, but I often hear some girls and mums worried that they do a lot of sport, and will that then contribute to delaying the onset of periods? Anne, you're on mute.
Please make sure that, you know, if your child or your young teenager is sporty, let them do as much sport as possible. There's no evidence that sport will delay the onset of menstruation and, you know, developing into a woman. But there's no doubt that when women are doing a lot of sport and are very lean, then that sometimes does stop menstrual periods occurring. So we would expect a young girl to start periods any time from about 9.5, 10 up until about 15, 16. So there's quite a wide range. And in fact, the age of puberty's got much younger. You know, when my grandmother was alive, her menstrual period started at 15. So did most of her peers. But actually now it's quite common for girls to start menstrual periods in primary school. But it's a little bit related to the weight. So you have to get to about being 45, 46 kilos before you'll start menstruating. So, and it's so variable. But if you're not starting periods by the time you're 15, don't panic. If you've got breast development, hair development, you're all on the right path. Sometimes it can be 16, 17. And there can be sometimes a link. If mum started periods late, then, you know, her children might do. So I think if you're not sure, get some advice, but there's such a wide range. But we do encourage, lots of girls don't like doing sport. Please get them doing any sport, even if it's the latest thing is cheerleading. Anything that keeps somebody active is all good. You know, we need to keep as active as possible and make sure that weight is kept at a reasonable level. Weight does play a part later on in your menstrual periods and how frequently and heavy they may be.
Thank you. So both underweight and being above the recommended weight, both of those contribute to the regularity of periods as well, isn't it? Thank you. If I could go to Caroline, please. Caroline, would you touch a little on when to seek help with period abnormalities and what options might people be faced with when they talk to a clinician or a professional?
Sure. Yeah. Hi, everybody. So, and we've already talked a little bit about the importance of healthy diet and lifestyle, and it's also good to know what's normal for you. So people's cycle lengths vary, and it can take a little while when you first start your periods for them to become more regular. If they haven't started by the age of 16, as Anne's just touched on, sometimes that can happen, but it's a good idea if you're worried to just seek further help. But in terms of your periods, once they've started, if they're very, very heavy, if you get a lot of heavy bleeding, if there's any irregular bleeding, if you bleed between your periods, or if there's a lot of pain, then it's a good idea to seek further advice. You can get over-the-counter remedies to help with symptoms around your period. There are over-the-counter painkillers like ibuprofen and paracetamol. You can get heat patches as well. But if you do have to seek further help from your doctor, they might offer you some other types of symptom relief. And there might be some hormone treatments that can help regulate your periods or just make them a bit lighter as well. If they feel they need to, the doctor can refer you onwards for further investigation or treatment as they feel necessary. I hope that helps.
Yeah, thank you. Thank you, Caroline. And Sarah, we know that women's needs change as we age based on where we are in our reproductive cycle, I guess. And it would be good to know how women can look after themselves right through these different phases focusing on diet, weight, exercise, and so on.
Yeah, no, absolutely. I mean, in general, there's lots of general things we can do throughout our life that can help us to look after ourselves and to be more healthy. And it's really thinking about sort of where those positive changes are that you can make if needed. And these can help with both our physical health, but also our emotional well-being, and also help to reduce our risk of disease in later life. And as you say, these would generally be around keeping to a healthy weight, being physically active, stopping smoking if you're a smoker, and being aware of our alcohol intake and reducing that if needed. And just touching a bit more on a couple of those things. So from a healthy diet perspective, so a healthy diet really means having a balanced diet, so eating a variety of food, but really trying to balance the amount of calories and energy that you eat with the amount of energy that you use through your physical activity. We know that eating at least 5 portions of fruit and vegetables a day can help to reduce the risk of health problems such as heart disease and stroke. And really thinking about sort of from an overweight perspective, if you regularly eat food and drink that's high in sugar, that can increase your risk of being overweight and also lead to increased issues with tooth decay. So it's really important to think about how you can reduce the amount of sugar in your diet. And from that dietary perspective, as women reach more of a perimenopause and menopause age, there's certain changes that's worth sort of thinking about within your diet. So it's important to have a diet that's rich in calcium, so thinking about things like milk or yogurt or kale, and that can help to keep your bones healthy. Vitamin D is really important to help absorb that calcium as well. That's found in particular food, but it also can be tricky in this country to get through diet alone, and particularly as we don't get that much sunlight in this country. So it's worth thinking about taking a vitamin D supplement as well. And particularly around menopause as well, it's important to think about the amount of protein in your diet, and that can help kind of retain your muscle strength, help with blood sugars, and thinking about food that are high in protein, such as nuts or lean meat, or eggs as well. So sort of thinking about those little changes that can help have a positive impact on your diet and on your health. Again, sort of looking after ourselves, it's important to be physically active. Exercising regularly has just so many benefits, really good for your physical health, really good for your emotional well-being. The general recommendations are that we are physically active for at least 150 minutes a week. That doesn't mean that it has to be, you know, going to the gym and having a gym session. It can be sort of a vigorous walk, doing gardening, doing activities around the house as well. And again, as we reach that sort of perimenopause, menopausal age, it's really, really important to build in more strength-based exercises into your routine. And that helps to prevent something called osteoporosis, which is a condition where your bones become weaker over time and are more likely to break if you were to have a fall. But by doing strength and weight-bearing exercise, that can help to protect your bones and build that strength back up. So again, that's things where your legs and your feet are supporting your weight. So it might be brisk walking, running, dancing, and also sort of a resistance type of exercise as well. So that's sort of touching on diet and exercise. I don't know, Lisa, if you want me to go on more around smoking and alcohol, or...
We can come back to it perhaps with the pre-pregnancy stuff.
Yeah.
And I was just reflecting that we can't forget the pelvic floor when we are talking about women. It's extremely important through the life course of a woman. And so as we have Catherine here, the expert, I wanted to ask you, Catherine, what can one do to look after the pelvic floor health, given that it's important for all phases of a woman's life?
Yeah, absolutely. So for anyone that doesn't know, your pelvic floor is a layer of muscles and tissues that run from your coccyx at the base of your spine. They go through your pelvis into that pubic bone at the front, and they support your back passage to hold in your poo and your wind. They support your vagina to prevent things like prolapse that Anne was talking about, and they support your bladder to hold in your wee. And there are a number of things that we can do to look after our pelvic floor. The first of those being maintaining a healthy weight, which Sarah's just been talking about. That's so important for pelvic floor health. The second is to look after our bladder and our bowels. So with our bladder, we should be aiming to ideally drink mostly water. I know that's a bit boring, but it's the best thing for us. And we should be restricting caffeinated drinks and drinks that contain artificial sweeteners. So things like squashes, fizzy drinks, energy drinks, they've all got lots of sweetener in them, which can really irritate our bladder. We want to try and drink nice and steadily, so having water right throughout the day rather than stopping and then having a whole pint of water in one go. Our bladder likes that a lot better if we're nice and steady. And then for our bowels, we know that constipation can make any pelvic floor problems worse. That could be things like incontinence or prolapse. And so with bowels, we want to try to make sure we're eating enough fibre. With adults, we should be aiming to eat 30 grams of fibre a day, but most of us are only eating about 20. So we need to think of little tricks to try and get our fibre intake up. Maybe for breakfast, trying to choose a whole grain type cereal like a Weetabix or a porridge, adding fruit into that. If we're having bread, try and have wholemeal or granary. And if we're having, for other meals, if we're having grains, try and think of brown rice or whole wheat pasta to up our fibre. With our meals, having a portion of vegetables on the side is really helpful, or adding it into the things that you're making. And pulses are brilliant as well for fibre. So things, if you're making a curry or a stew or a salad, see if you can add in some pulses to that. So chickpeas, cannellini beans, lentils, those kind of things. And for our snacks, perhaps picking things like fresh fruit or vegetable sticks, or having a small portion of unsalted nuts or seeds can be helpful as well. And with all of that fibre, we need to make sure we're still drinking enough water, which is what helps to then keep our stools nice and soft, so they're easy to pass. The other thing that helps with constipation is to keep moving regularly. So that 150 minutes of moderate intensity exercise a week really does help our bowel as well as our physical and mental health. And really trying not to ignore any urges to go to the toilet, giving ourselves enough time in the day. I think we're so busy, we can even forget to pay attention to our bowels. So making sure we've got enough time in the morning before we're leaving the house to give our bodies a chance after having some breakfast to see if we can go to the toilet before we've even left for the day. And of course, we need to look after our pelvic floor muscles by doing pelvic floor muscle exercises.
Thank you, Catherine. I just wanted to say to members of public, thank you for posing questions. But when it's a very personal question relating to you as an individual, I think the panel members will not be able to answer it because they don't have your entire medical history. And I think it's better then for you to speak to your GP or specialist who may be at your practice or otherwise. But if it's a general question, please do ask. We'll collect themes and our panel members are trying to answer them as we go along as well. And I want to come back to Catherine. You mentioned pelvic floor exercises. So how does one actually practice that?
Yeah, so we should ideally be practicing these every day, a bit like we brush our teeth every day to look after our dental health. We should be doing our pelvic floor every day to look after our pelvic health. So when we practice them, we want to make sure we're comfortable. We're in a nice relaxed position. And the first part of a pelvic floor exercise is to think about your anus. And you're trying to squeeze your anus as if you're stopping yourself from passing wind. And you want to try and squeeze the muscles there as tightly as you can, as if you really don't want that wind to pass, but without squeezing your whole bottom. It's not your buttocks that you want to squeeze. It's not your whole bottom. It's just the back passage itself that you need to squeeze. And you want to practice trying to squeeze and hold and see if you can count to 10. And if you can't, don't worry, you can practice and build up to that. That's the first part of pelvic floor. The second part is to imagine that you're going for a wee and that you're on the toilet and you want to make your urine stop mid-flow. And if you can do that, that's actually quite a good sign that your pelvic floor are working nicely. Don't do it all the time, but it's a good test to see if your muscles are working. What you want to do is, away from the toilet, practice that same idea. So squeezing and drawing in as if you're stopping your urine mid-flow, and see if you can get that feeling. See if you can hold and count up to 10. And if you can, brilliant. If you can't, don't worry. You can build up to doing that with practice. Make sure with your pelvic floor that you relax fully between each contraction that you try, and keep breathing. We all tend to hold our breath as we concentrate, but as we get better and a bit more practiced at doing it, we can hopefully breathe through those contractions. So in an ideal world, every day we should be doing around, well, at least one practice of pelvic floor exercises where we're doing some where we really think about the back passage and some where we really think about the front. If you're having symptoms though, if you're having bother with your bladder, perhaps some incontinence symptoms or some frequency or urgency, then we need to think about upping that. The recommendation is that we're doing 3 practices a day for a minimum of 12 weeks to help those symptoms. And if we're having any prolapse symptoms, such as a feeling of vaginal heaviness, feeling like something's coming down, then it's recommended that you do 3 sets of exercises a day, but more like a minimum of 16 weeks to really get those muscles going. There are a number of apps that you can use now with your pelvic floor as well. So perhaps have a look for the Squeezy app. That's a really excellent app you can use to help your pelvic floor. And the other thing is that we've done a video about how to protect your pelvic floor. And I know that's going to be going into the chat shortly for you.
Yeah, thank you. I know the video that you created is really good. I'm sure some people were practicing it even as you were speaking, Catherine. Sarah, I just wanted to continue the conversation we had slightly earlier. So when someone's planning a pregnancy or during a pregnancy, it's really important for well-being to be focused on even before one gets pregnant. And you were unable to touch on alcohol and smoking because you were worried about the time. Would you like to touch on that pre and during pregnancy as well, please, along with any other advice and supplements you want to talk about?
Yeah, no, absolutely. I mean, as you say, when you're kind of considering or starting to plan to get pregnant, it's a really good opportunity to think about where you can make some positive changes. And for the most part, the advice is really similar to earlier in terms of kind of healthy diet and being physically active. It's important to keep moving in pregnancy. However, there's some other really specific things, and particularly around smoking and alcohol. So if you smoke, stopping smoking is one of the absolute best things you could do for your baby. Stop smoking in pregnancy is linked to premature birth, so babies being born before their due date. It's linked to babies having a low birth weight, and also linked to sudden infant death as well, which is known as cot death. So it's really important to kind of think about how you can reduce and ideally stop smoking in pregnancy. And there's lots of support out there to help you. There's free services provided by the NHS, and those include both general support and advice, but also kind of helping you to go on to nicotine replacement as well. And you can find these services either through your local council website or through the NHS website as well. Moving on to alcohol. So drinking alcohol in pregnancy can also lead to long-term harm as well. And the more you drink, the greater the risk. So therefore, we do recommend that if you are pregnant or thinking about getting pregnant, then to try and cut out alcohol completely, and that will keep the risk to the baby as to a minimum. And again, there's sort of support out there. There's some advice on the Better Health website about sort of tips to stop drinking and how you can swap that out. But if you have any difficulty stopping drinking, it's worth speaking to your midwife or doctor or pharmacist, because confidential support and help is available from a number of different organisations. So that's both national groups, but also there's lots of local support services that will be able to help you if you're concerned. And then just touching on supplements as well. I mean, we've talked about healthy diet, but there's some particular needs when you're pregnant that are important to be aware of. And the main one is around folic acid. So that's a supplement that's recommended for women to take both while you're considering or planning to get pregnant and up to at least 12 weeks of pregnancy. And folic acid is recommended because it reduces the risk of the baby having what's called a neural tube defect, such as spina bifida. And this is an issue that affects the baby's spinal cord, so part of the back where it doesn't develop properly. But we know that by taking a daily dose of folic acid, that can help reduce the risk of that happening. So it's really important to do that. And we also recommend that pregnant and breastfeeding women take a daily supplement of vitamin D. As we talked on it earlier, vitamin D can be tricky in this country to get through diet alone, but it helps you to absorb calcium from your diet, which is needed to keep kind of bones and teeth and muscles healthy. So they're all the things to kind of think about while you're considering and planning for pregnancy. And even if you had an unplanned pregnancy, then it's worth kind of starting those at that point as well.
Thank you for that, Sarah. So, Caroline, when someone walks into a pharmacy trying to purchase either folic acid because they're either trying for a pregnancy or are pregnant, there are multiple pregnancy vitamins, as they're called, some brands more expensive than others. What should they be looking for?
So with folic acid, you want to look at the back of the packet to see how much is in the particular vitamin supplement that you've picked up. And you should make sure that it's got 400 micrograms of folic acid in it. There are lots of pregnancy vitamins, lots of branded ones that contain other vitamins as well. And some supermarkets or pharmacies do their own brand, which can sometimes be more readily available and more affordable as well. You just need to make sure that anything that you pick up says that it is suitable for use in pregnancy, because there are some vitamins that aren't in high doses aren't safe for use in pregnancy.
Thank you. Thank you. And as we know that some women do need a higher than standard dose of folic acid, which obviously you can't buy over the counter. Would you highlight this group and how those women can actually get access to that higher dose of folic acid, please?
So if the BMI is the body mass index that is 30 or above, then you're advised to take a higher dose of folic acid. The usual recommended dose in pregnancy without any other complication, a normal pregnancy is 400 micrograms. But if you are heavier, or at higher risk of conceiving a child which might have a neural tube defect, as Sarah said, that folic acid is very important for development of the brain and spinal cord. So they need to have 5 milligrams of folic acid. And that is because if you're heavier, then there is the chance that you are not metabolizing folic acid quite in the same way as somebody who is lighter is. Also, if you have had a previous history of a baby with a neural tube defect or a family history, or your partner's had it, if you're taking anti-epileptic medication, because that interferes with folic acid metabolism, and if there are certain conditions like diabetes or sickle cell anemia or thalassemia, which are disorders of the blood, then they're advised to take 5 milligrams. You cannot buy 5 milligrams of folic acid over the counter. So it's a prescription from the GP. Now, there may be certain areas where, due to circumstances, it may be expensive and the woman cannot access it. So in certain areas, there are ways in which you can actually get free, prescriptions. And once you're pregnant, you're entitled to free prescriptions anyway. So that will be arranged by the midwife.
Thank you. Thank you. We know that choosing the time to get pregnant allows women to optimize their health, as was highlighted so well earlier. And we know that safe contraception plays an important role in getting the timing of pregnancy right. So, Caroline, if you could highlight a little bit of the difference between the two common types of pills that women are prescribed, because I often come across women who are not entirely clear on the taking of the combined contraceptive pill versus the progesterone-only pill. Would you please highlight this for us?
Sure, yeah. So you've already mentioned the two main types of oral contraceptive pill. So there's the combined oral contraceptive and the progestogen only. The progestogen only is sometimes also called the mini pill. So the combined oral contraception contains both estrogen and progestogen, and those two hormones work together to help prevent pregnancy. Usually you take 1 tablet a day, and there would be a 4 to 7 day pill-free break, and that's when you would have a withdrawal bleed. There are different regimes and lots of different options available for combined oral contraception that contain different amounts of both hormones. So it's just important to make sure that when you have a consultation with your healthcare provider, whether it's a doctor or pharmacist, that they go through all the different options for you. Generally, the combined oral contraception is for younger women and healthier women. There are some types of health conditions where the combined oral contraception might not be suitable, such as a history of blood clot, some types of cancer, or very high blood pressure. So moving on now to the progesterone-only pill. As the name says, that just contains progesterone, so there's no estrogen in that one. It can be a good option if you cannot take any estrogen. Maybe you've had side effects with estrogen-containing pills before. It can also be used in breastfeeding. It can be used with older women who smoke and with a history of some types of migraine. With the progesterone only or mini pill, you would take a tablet every day, and there's no need to take a pill-free break with this. Sometimes women, actually the bleeding will stop completely, but with the progesterone only pill, it's important that you take it at the same time of day every day for maximum effectiveness.
Thank you. Thank you. The hormone replacement therapy is made up of similar kind of hormones, and I wonder whether, Azmi, you could just highlight in brief as to who might need both the hormones versus just one hormone.
Yes. So right at the start of this webinar, Anne showed a lovely graph of how estrogen thickens the lining of the womb, and then there's ovulation, and then progesterone is released, and if there is no fertilization, there's no pregnancy, then progesterone breaks down the lining of the womb. Then you have a period every 28 days. So the function of the progesterone is to thin down the lining of the womb. The estrogen tends to thicken the lining of the womb. Progesterone thins it down. Now in HRT, if you have got a womb, even if your periods have stopped, and it's menopausal hormone therapy, if you take estrogen without progesterone, the lining of the womb can thicken. And we don't like anything thickening and cells growing indefinitely because of the worry that at a later stage, it could develop into cancer. So women who have a womb will need to take both hormones, the estrogen and progesterone. However, if they have had a hysterectomy, then the womb has been taken away and there is no need for the progesterone. So they can have estrogen only HRT. The only other thing I'd like to say, Lalita, is unlike the combined pill, which has two types of hormones, estrogen and progesterone, the estrogen in the menopausal hormone therapy or hormone replacement therapy tends to be estradiol, which is similar to what the ovaries produce, because you're using it to relieve symptoms, versus the estrogen in the pill, which is a synthetic estrogen called ethinyl estradiol, which is 113 times stronger because we want it to inhibit ovulation and prevent people getting pregnant.
Exactly. Thank you. Thank you so much. And Anne, a very quick question. If someone has medical conditions and wants to get pregnant, what should they remember?
Well, I think if you're thinking about getting pregnant and you have a health issue, diabetes or high blood pressure, then check with your GP before you fall pregnant. For instance, if you're diabetic and using insulin, we want your blood sugars to be really well controlled before you fall pregnant, because that will reduce your risk of birth defects in your baby and health problems during the pregnancy. Similarly, if you are epileptic or you have a family history, then you need to start taking your folic acid 3 months before you're planning to fall pregnant. If you are on blood pressure medication, please don't stop your antihypertensive medication. It's important to carry on with your medication if you're taking it for depression, if you're taking it because you've been advised for certain health conditions. Get advice from your GP about whether you should carry on taking it during pregnancy or not. The vast majority of medication we want you to carry on taking. Thyroid hormone, for instance, or if you're on medication for, say, rheumatoid arthritis, we don't want those conditions to get worse during pregnancy. And virtually all medications are safe to continue, but there are a few that it's best not to be on when you conceive. So get advice from your GP before you plan to fall pregnant. And once you do fall pregnant, make sure you book early with your midwife. And that's done online through the maternity portal. If you're going to book at Frimley Health, either at Wexham Park or Frimley Park Hospital, go onto the maternity portal and you can book. And your midwife, if we think you need to be seen early, then we'll see you before 12 weeks, but normally the midwife will come out and see you at around 9 to 10 weeks, although we will expedite your appointment if from your medical history you should be seen earlier than that sort of time. So just a plea to you, don't think I'm falling pregnant, I better stop all my medication. No, get advice before you do that.
Thank you. My question to Caroline, there's a link in the chat as well on community pharmacies, and they're doing a lot more now. We're able to get antibiotics from community pharmacies for certain conditions as well. So could you touch on the role of community pharmacies in access to emergency contraception or other contraception, and also for treatment of urinary tract infections, please?
Yeah, sure. So community pharmacy is an excellent place to get free advice on healthcare conditions and minor ailments, especially related to women's health. They offer a walk-in service, but just bear in mind that you might need to wait if you do go in at a particularly busy time. So in terms of contraceptive advice, pharmacists can help you give you information about how to use contraception safely and effectively, as well as any emergency contraception options out there. So in terms of the emergency hormonal contraception, this can actually be purchased over the counter. In some areas, the pharmacies can offer emergency contraception without a prescription free of charge in some patient groups. So if you were to Google emergency contraception and then your area, then you should get some further advice and help. There might be some links coming in the chat, I think, as well for areas within the Frimley ICB footprint. In terms of oral contraception, there's a new community pharmacy advanced service out there, and we've got a lot of pharmacies signed up to provide this service within Frimley. This would entail you having a confidential conversation in a private consultation room with the pharmacist, where they'd ask you lots of questions, well, not lots of questions, relevant questions about what you're looking for in terms of oral contraception, any medical conditions, any other medicines that you're taking as well. And they can help you to choose the most effective contraception depending on what you're looking for and your lifestyle as well. So to find local participating pharmacies, you can use the pharmacy finder or the pharmacy service finder online. Pop in your postcode and it should give you some local participating pharmacies. If you call them up in advance, they might be able to tell you when's a slightly quieter time for you to be able to go and have that conversation with them. In terms of urinary tract infections, the Pharmacy First service does include treatment of uncomplicated UTI in women between the ages of 16 and 64. So you can either be referred into this service from your GP. So if you do contact the GP with symptoms of urinary tract infection, you might be offered a consultation with a community pharmacist. And this can help because you could potentially see the community pharmacist the same day, rather than maybe having to wait a little bit longer for a GP appointment. So again, the pharmacist would talk to you in the private consultation room to ask you some more questions. If they are following quite strict guidelines and they can provide antibiotics for suitable patients, they can offer advice if your symptoms aren't suggestive of needing antibiotics at that stage. They can offer you over-the-counter treatment or other advice. And they would always tell you where else you would be able to go. So if you're offered antibiotics, they would tell you if the symptoms are not getting any better or they do worsen, where else to get further advice and treatment. If they can't provide you with something, they will be able to refer you onward to a relevant healthcare professional who'd be able to help as well. So it's a really exciting service.
Yeah, it is. It is. And then it obviates the need to go and make an appointment with your practice. So it's really good. Thank you. Catherine, if I could come to you specifically to ask about how can one prevent recurrent urinary tract infections? Because we know that some women suffer quite badly with recurrent urinary infections. So any thoughts on that?
Yeah, I mean, a UTI is usually caused by bacteria from our poo entering the urinary tract, and they enter through that little tube that carries your wee out of your body, the urethra. But it's tiny bacteria, so it's nothing that you're sort of conscious of, if you like. And our risk of UTIs increases with menopause, unfortunately. So some key tips really are to try, when you're wiping, having been to the toilet, to always try and wipe from the front towards the back, so that you're not bringing any bacteria forwards. That you try to keep your genital area clean and dry, and if you're using pads regularly, then try to make sure that you're keeping on top of changing those. Drink plenty of water nice and steadily through the day, so that you're taking wheeze at regular intervals and sort of clearing the urethra that way. Trying to wash the skin around the vagina with water before and after sex, and if possible to pee as soon as possible after sex as well. That can help. Try to avoid things that are scented, so scented soaps and shower gels, that sort of thing. Trying not to hold our pee too long if we're feeling the urge to go. And when we're in the bathroom, just taking our time, making sure that we've fully emptied our bladder before we're going off to the next thing. Something else that can be helpful is to make sure we're wearing breathable underwear, trying to avoid synthetic materials like nylon. Try to avoid bladder irritants, so that's things like your alcoholic drinks, your fizzy drinks, sugary drinks, because sugar will encourage that bacteria to grow. There is some evidence, though, that something called D-mannose, which is a sort of extract of cranberry, and that's where the cranberry juice link comes in, that can reduce our risk of UTI, but you have to be a bit careful because there's lots of sugar in D-mannose. So whilst it can be helpful, if you're diabetic particularly, it's not one that's suitable for you. And for our postmenopausal women, if you have symptoms of vaginal dryness, irritation, if you're getting recurrent UTIs, then it can be very helpful to look to use vaginal estrogens if they're suitable for you. And that's something that you can discuss with your doctor.
Thank you. Thank you. Asmi, could I just ask you very, very briefly to highlight and help women who are trying to get pregnant, and they may have done everything that Sarah recommended, and as a couple, they haven't yet got pregnant. Could you touch briefly on when they should seek help?
Yes, so women under the age of 40 who have been trying to conceive for a year, and especially if they are having regular 28-day cycles, 80% of them will conceive within the first year. And most of them who have not conceived, a substantial proportion will conceive in the following year. So we don't have a hard and fast rule to say that, you have to be trying for X number of years. But in general, it is very reasonable to at least wait a year and to give it time, because there are lots of other things like making time for one another, having regular contact with each other, that make a difference, to conception. So all being well, usually most couples who are, especially when the woman is under the age of 40, will conceive within the first year. However, if they are older, they may need to seek help earlier, within 6 months or so. If their periods are erratic, they should be seeking help earlier. And if they're having any symptoms like discharge or pain or bleeding, they need to, contact the doctor.
Thank you. Thank you. And I just wanted to add 3 general resources. I wanted to take the opportunity while we have everybody here to share these 3 resources before I say thank you. And the panel's looking at questions anyway while I do that. So the first one is an app called Sleepio. So we all know that a good night's sleep and rest refreshes and recharges us, sets up really well for the next day. But if you struggle to sleep, we actually offer the Sleepio program free of charge to all our Frimley residents. It's not available free everywhere nationally, so we're really lucky we have this. Research has found that Sleepio, which is a 6-week digital sleep treatment, helped people reduce the intake of sleeping pills, time off sick, and gain hours of sleep, which made a big difference. So if you look for the app, you can get it on any app store, whichever phone you use, and just hit the Get Started button and it'll take you through. The next resource I wanted to mention was the Get You Better app. Now, this is an app for all muscle, bone, and joint conditions and injuries, not just for women and men, of course, both all the apps I'm talking about. It is again available for free. It is locally configured by our specialists. It is personalized. It allows you to recover from maybe a pulled muscle, a little bit of knee pain, joint pain, and so on. Anyone above the age of 18 can use this as a self-management tool. And you can access this again via the Frimley ICS website. You can access this from Google and Apple Play. And some pharmacies even have a little QR code that you can link into. And the final app that I want to share with you is what is called Healthier Together. So for those of you who have children under the age of 18, Healthier Together is an app and a website which you can look to when you're worried about their health. So rather than looking at Google and multiple sites, this is just one place you have to go when you're worried about physical or mental health. There's even things on cost of living support with children and young people. And local and national specialists have inputted into this app. So please do look at those. The links are all in the chat. And what I want to now do is say thank you to my panel who have been here, have spent their evening with me to give you information. And thank you to my team who are behind the scenes putting all these resources in the chat, and they have helped with the administration of this webinar. But last and not the least, and most important, in fact, is thank you to all of you who've joined us today, who have actually spent your evening with us, listening and wanting to empower yourselves and sharing your thoughts in the chat as well. So thank you for your participation, engagement, and let's stay connected, stay informed, and let's take care of ourselves. Have a wonderful, wonderful evening. And remember, this is a beginning based on what you've said in the chat. If you're interested in any further topics, please do put it in the chat. We will take that away, come back in the new year with specific topic focused information for you. We were trying to cover a lot for you today. So please have a wonderful evening. We look forward to seeing you at future events, and do let us know what you want to hear more about. Thank you so much. Thank you from all of us on the panel.
Bye-bye. Bye-bye.
Bye.